Todd, thanks so much for the wonderful introduction. I appreciate it. And friends in Los Angeles in the tech community, it's really a privilege to be able to speak with you and share with you the work I've done and the work I'm continuing to do. I'm really grateful for your time. As Todd mentioned, I'm a physician, and I am the founder of both Heal, which I started 7 years ago, and a new company I've started in the last several months. Just like every founder, I came from a personal place when I started my own companies. I was born here in Los Angeles, and I'm the daughter of two doctors, both immigrants, both people who came to this country way before there were cell phones and internet and Wi Fi and computers. And they gave me a very privileged life. They led me to a life of service. And 20 years ago, I became a doctor. I did schooling out in Chicago, and I've been so in love with LA all this time. I came right back and I did my residency at UCLA and my training at USC. And while I was in private practice as a kidney doctor, I was one of the first doctors in my own community to set up an EMR and use it meaningfully. I guess that's how old I am. And in that process of creating a wireless, paperless office, I began to learn the burden of being a physician in private practice. Complicating that, unfortunately, I wanted to become a mother. I met my partner, my husband, Nick Desai, who's a prominent entrepreneur here in Los Angeles as well. And when we got married and decided to expand our family, it was full of travesty and tragedy and so much hardship that I almost didn't think I'd get it done. And yet here I am, successful as a mother of three wonderful children who are the purpose behind everything I do. And in that experience of doctor meets mother, I really fully took my journey into being an entrepreneur. And I thought about how to make life easier as a patient. What we all have in common is that we are patients. 7 years ago, when I started Heal, effectively, I had a baby who was sick. That baby was born into the intensive care unit for children. And I was stressed out and I was confused. And most importantly, I was a doctor that didn't feel like I was getting the experience I should have gotten as a doctor. And the fact is, I have everything. I have money. I speak English. I am educated. And I thought I would understand what was going on around me while my son was sick. And one night while I was driving home from a very scary trip to the emergency room, I had a talk with Nick, my husband, and I said to him, there has got to be a way that parents can better take care of children in their own home. And through that conversation was born Heal. The mission of Heal was to deliver accessible primary care in the home using software. Essentially, what we wanted to do was get into a patient's home, do a house call, and while we were there, set the patient up with remote monitoring devices, as well as video telemedicine so that they could have high touch access to their doctor. And we wanted to do this for all ages. And most importantly, we wanted to do this 7 years in advance of a pandemic. So you can imagine that we were met with a lot of hesitation and concern. How is this going to work? What kind of a doctor is going to join you? How is this going to be convenient and affordable? And this may sound incredibly mundane, but the first thing we had to do, and I learned, was how inefficient a doctor's day is. The average doctor in private practice has to see about 40 patients in that doctor's office to be profitable. The first 23 patients of that doctor's 8-hour days simply pay the bills. That same doctor spends 60% of his or her time filling out forms, answering silly phone calls, begging for services that that doctor knows their patient needs. On the other end, you have insurance. And how does insurance work? Well, it's a mystery. At the end of a visit, you get a bill from your doctor. You get a statement, an explanation of benefits that honestly makes no sense. And you have to figure out what you just paid for and was value delivered. So again, it sounds really mundane, but the first thing we had to do, and the first thing we did at Heal, was figured out how to deliver real-time eligibility to our patients. So 7 years ago, we built software that allowed a patient to enter a credit card and an insurance card and see immediately what a house call would cost. And more interestingly, more often than not, that house call was free. It was a physical exam that was free. And the patient could then experience excellent health care in the home. We then had to take doctors who, of course, wanted to invest time in their patients. And instead of seeing 40 patients a day, wanted to see 10 patients a day well, do what was best for their patient, advocate for their patient. And so we began by hiring excellent doctors who wanted to deliver care in the home. And lo and behold, you had an experience where using software, we routed, dispatched doctors to patients' homes, and those patients have never gotten a bill. They have never gotten a statement. What they have gotten is excellent health care at the cost their insurance allows. And we, at that moment, even though it sounds so silly, we changed the delivery of healthcare. Once we got in the home, we were able to see how our patients lived and what barriers or blockers to care they had. Our patients, we noticed, did not have access to food. They did not necessarily have a device to use Heal. To this day, Heal has a phone number to book a house call. They did not have a ride to their specialist office, which is why they were using Heal to get primary care in the home. And the work we did at Heal, it is something that it is one of my proudest accomplishments, right? We delivered almost 300,000 house calls by the time I had left. We had reduced ER and urgent care visits by nearly 60%. We had evaluated 88% of social determinants of health. Again, those very things that prevent a patient from living a well life, access to food, transportation, Wi-Fi, and all the while maintained a net promoter score of 79, which in the healthcare industry, many of you know, is unheard of. So again, I'm telling you that we figured out real-time eligibility using software. It doesn't sound sexy, but we improved upon the delivery of access to care, and we did it in the home where we learned more about our patients. I've stepped away from Heal in the last several months because I've been thinking a lot about this digital health revolution of which I was a part. And again, I couldn't be more proud of the work I did at Heal. But now billions of dollars are being poured into health tech. And we are in the midst of a revolution. And as such, we should be having an industry-wide transformation. But the problem is, and I'm going to get into it a bit more in my coming slides, we're not yet. And so what I'm working on now with HeyRenee is this notion that a patient is complicated and that patient is a human. And I want to better understand that human, what that human needs, put all of those software apps and platforms on one system, which we have called HeyRenee, and be a part of a patient's digital health journey. Every patient needs to be understood so that patient can feel included and empowered to make choices. And our job is to coordinate and deliver a concierge experience for that patient by bringing together all of their needs in one ecosystem. This means that the patient's app for mental health, their company for pharmacy delivery, however they're getting reminders to see their doctor or follow up on lab results or get medications refilled, whatever they're using to see their primary care doctor, whether it be in the home or in the office, should all be available in one place for that patient to reference. And all of those pieces of software should communicate with each other so that the patient is not part of our disconnectedness, but rather we are looking at that patient holistically. HeyRenee will create the concierge experience to unify this disconnected ecosystem. So I discussed previously, there are problems. Billions of dollars are coming into digital health. And yet, in my mind, we are not transforming the paradigm. We are not shifting. And so why are we not shifting the paradigm? Well, for two reasons. First, and all of us are trying very hard to solve problems, but at the moment, the solutions are probably too pointed and do not recognize the complexity of a human who needs healthcare. And so, for example, there's an app to get your medications delivered. There's a separate app to use video telemedicine. There's an app to book a house call. There's another app that will help you with your mental health disease. None of these apps talk to each other. None of these providers of care are unified on one ecosystem. And thus, we are expecting a patient, and certainly someone who might be sick or elderly, to go onto 4 different apps, upload information over and over and over. And so, simply put, it's just not going to happen. And so, what you will see is being left out of the digital health revolution are our seniors and our minorities, people who cannot get the accessibility they need in the first place and do not have the context to understand that they need to do something 4 times to get a holistic health experience. I'll also explain to you the business of pricing models. In America at this time, 60 million people are of Medicare age, and 20 million of those people are on a Medicare Advantage plan. And there was an excellent article published in late September in the Journal of Health Affairs that explains these pricing models. Effectively, a patient is assessed when that patient joins a Medicare Advantage plan by a risk assessment score. Depending on how sick the patient is, how many medical problems they have, they are deemed to be very sick or a little sick. And based on that sickness score, Medicare gives that Medicare Advantage plan money. Now, you will see in the news on every other week basis the number of concerns that the Department of Justice is raising about risk score gaming. And this is such an important concept. In other words, a patient may have 3 medical diagnoses that make them sick, but because of gaming, they are being critiqued or documented as more sick. And in fact, we are even using care models, delivery models to go in the home or bring the patient to a certain center of excellence to determine if they can be qualified as more sick to gain more from Medicare upfront. And as such, plans and risk-bearing entities are becoming financially profitable, but there is question about whether or not they are actually improving outcomes. And this is such a subject of important discussion. Since 2006, this has been going on. And as we know, insurance is a very large part of how politicians have the money to be elected. And thus, for years, nothing has been done to rectify this problem. Now, CMS is starting to get in front of this problem. And they have an innovation center and direct contracting models to reach out to physicians in private practice directly to try to improve on this notion of gaming risk scores. And so hopefully that is going to change the method in which many people, part of huge corporations, have financial viability without the responsibility of improving outcomes. The other part of the problem is happening to my brothers and sisters who are physicians and providers of care. When I started my private practice 17 years ago, it was a fading idea, and I was unique for doing it. But now, over 60% of physicians and providers are hired by large corporations. When I started my private practice all those years ago, I was an innovative person and I wanted to think independently and I wanted to advocate for my patients. I did not want my decision making to be misaligned with the people that were paying me. Now, because doctors are overwhelmed and exacerbated by the number of things that they are expected to do, they cannot handle being in private practice and a business anymore. And the outcome for doctors is very concerning. We've had a 0% increase in people who practice primary care, but we've had a 5,500% increase in people who administrate over doctors, right? And so we have gone from taking doctors who should be independent, innovative thinkers to making them employees of large corporations. And as such, we have prioritized profit over the principle of getting patients well. We need to go back to a system where doctors are eager and independent thinkers. When you take away a doctor's independence, you take away a doctor's ability to innovate. We doctors should be able to use software to expand our breath, not control us. And so again, I submit to you that what you're seeing is skimming from the top, unfortunately, at the moment. Many corporations and even startups have found ways to solve a smaller problem for a smaller volume of patients and earn profitability. But the question is whether or not we are actually improving the lives of our patients. And so we need to look at ground up innovation. We need to step back. We need to understand our patients, understand from where they are coming, understand that they are human, that they come with complications, that not everybody is the daughter of two doctors who then encouraged her to become a doctor, but rather many people may have grown up near a freeway or with a smoker or only able to find fast food accessibly. And as such, they've grown up with many risks that have gone on to give them diabetes and obesity and heart disease. When we allow ourselves as healthcare entrepreneurs to understand our patients, we humanize them. And when we humanize them, they will trust us. And when they trust us, they will allow us accessibility to their data. And I share with you that when we can understand their data, we can then build intelligence. And so, of course, all of us interested in the community of building intelligence, the business of acquiring data is everything. Right now, patients are in a state of such mistrust and distrust. And we knew this for years and years, but what COVID has done is shone a light on how terrible it is, right? The fear of getting vaccinated, the fear of going to a doctor's office and getting preventive screens is at all-time highs right now. And it is the patient's apprehension that has grown from our systematic abuse of not humanizing patients, but rather focusing on profits and not outcomes. What we want to build, and certainly the work I've been doing for years now as an entrepreneur in the tech community, is a patient who is engaged. A patient who is engaged has trust. She will share. She will use remote monitoring devices. She will be willing to learn how to use video telemedicine or willing to allow us to put devices in her home that will communicate with her. She will not be worried about what we are doing with her information, but will rather believe that we are using her information to help her. And thus, we can be proactive and preventive for our patients rather than putting out fires. I cannot say this enough. We must humanize our patients so that they trust us. And look, I'm a part of the tech community. Apps are cool. The work the founders in our community are doing with me, I am so lucky to be a part of such an exciting group of people I consider friends and colleagues, and we're all trying to do something important. But the problem is we cannot be artificial about it. Patients have sussed us out. We must be thoughtful, we must be holistic, and we must think about a patient across her lifetime journey. We cannot just wonder why a diabetic may be overweight. We need to see what kind of food that diabetic can eat, what kind of education that diabetic is getting about what he should eat. What kind of supplies or pharmacy or copay does the patient have to work with to be able to manage their diabetes? And finally, being diabetic is scary. Have we looked into the patient's anxiety or depression? Have we put that entire story together for a patient so that their experience is not siloed, but rather we have built an orchestra which will then make a beautiful symphony? Or as my husband Nick likes to say, we have all the ingredients, the flour, the butter, the sugar, but we need to bake the cake for our patients. The inability to understand our patients completely means we do not understand their motivations. And if we don't understand their motivations, we are not going to build this symphony that I speak of. And I'll also share with you, as a doctor, what I see happening with software is so exciting, but we have work to do. Right now, doctors principally use diagnostics to get lab results or to look at metrics like a blood sugar or a blood pressure. But the fact is, as a doctor, what I'd really appreciate software doing for me is assisting me with decision support. I'll take an example of a patient with high blood pressure. If a patient calls me every time her blood pressure is high or shares data with me every time her blood pressure is high, I'm going to be overwhelmed by the number of times her blood pressure is high. And I will want to do something about it. But the fact is, I have too many other patients and not enough time to help her. So, what if decision support looked at that patient's blood pressure and reached out to that patient by software, by text or voice, and said to the patient, your blood pressure is high. Did you take your medications today? The patient says, no, I didn't. I'm out of my refills. No problem. Let us order your refills and we'll deliver them to your door. And once the medication gets to your door, we'll remind you to take your blood pressure medication. And then we'll also remind you to take your blood pressure to make sure it's getting better. Now, if we notice that that patient's blood pressure is not getting better, then decision support after a few days can help us to book that patient an appointment. And maybe that patient doesn't need to come into the office, but rather that patient can have a video telemedicine experience where that patient will need a doctor who's available for more urgent issues rather than the primary care doctor, keeping in mind that urgent doctor's availability and notes will then be shared with the primary care doctor on a unified system so that the patient's experience is streamlined and the plan of care is one. And this could not be a more important concept to help me, the doctor. Ultimately, if we can improve on decision support and I can be supported with software, then I can be proactive in my delivery. And this means that instead of waiting for my patient's blood pressure to rise, I can look at my patient when she's in her 20s and 30s and recognize that she may be at risk for high blood pressure based on her genetics or her weight or her pre-diabetic conditions. And I can help her to avoid being hypertensive at all. And this is where medicine needs to get using software. But I submit to you, we must first build the intelligence by looking at how, for example, we're using diagnostics. At HeyRenee, internally, we have a term called the Internet of Aging. And it's something we talk a lot about because we're so committed to this notion of unifying a patient's health tech experience. And so we envision a day where we are looking horizontally at our patients, and the moment she opens her fridge, she gets a reminder that she needs to eat less salt and perhaps avoid using butter for avoiding saturated fats. We imagine a day where our very patient is watching television and gets a reminder to take a blood pressure pill or get up and stretch and work out that kink in her shoulder. We want to use software to be proactive and deliver a different kind of care to our patients, one that unifies every aspect of her life to her health, so that while she is home, she is well. And so right now, everyone is practicing primary care and we're giving it our all of us in the health tech community, us doctors, us clinicians and providers of care, us therapists, we're all a part of primary care. But in the last year or two with COVID, we've actually started to enter the business of preventive care with vaccines, for example, and with testing. And we all saw it was not without great effort and confusion, and it still is. But we are trying, and we are getting to a place where preventively we are building trust with our patients a little bit better. But as we build trust and as we humanize our patients, and as we collect their data, we will get to a place where we will be proactive and finally build enough intelligence to be predictive. What we all want in the end, and all of us on this call are going to be aging at home. We all want proactive, predictive care so that we don't get sick. By the time us on this symposium are 70, 80 years old, we will not be using a doctor's office. And frankly, we will be using a hospital or an operating room very differently. Instead, we will be using software at home to predict our needs. And so I thank you for indulging me and taking your morning with me to listen to my thoughts and my perspective on how to humanize patients, build trust, and build intelligence. I'm so grateful to you, and I welcome any comments. And again, thank you so much for your time this morning.